My name is Allison Clark, and I'm the Community Engagement Manager here at Sheltering Arms Institute. I appreciate you all joining us today for our community transition event for our stroke unit. In an effort to stay connected with you all after discharge, we're providing quarterly education opportunities for our patients and families. Our goal is to continue to share educational information, tips, strategies, and resources to continue to support your healing recovery as you transition home. So the future plan for our community transition events is that they will be held on site in our education conference room at the Institute. But until then, we're pleased to offer a virtual option. So for today's stroke community transition event, I'd like to introduce Logan Shuping. She is the PT clinical leader on the stroke unit at the Institute. And Abby Colley is an exercise physiologist and PowerX lead at Sheltering Arms. So Logan is going to start off today with speaking about health and fitness post-stroke, and then we'll follow up with Abby, who's going to share some resources for some local fitness services here, as well as information about resources and things to look for in other fitness facilities outside the Richmond area. So that being said, I think we're ready to get started. So I'm going to turn it over to Logan to begin the presentation.
Thank you so much, Allison. It's good to see some familiar faces out there. So today we're going to be talking about promoting health and fitness post-stroke. So some of our objectives are to review exercise guidelines, describe safe methods of exercise, and also to provide resources to promote fitness. So know before you go. So always ask your doctor before starting a new exercise routine. It's important to monitor your blood pressure at home. So blood pressure machines can be purchased at any drugstore. They're pretty inexpensive. It's especially important after a stroke since blood pressure is a contributing factor to strokes. So you want to keep a log at home so you can show your physician at the next appointment. They've got kind of the wrist cuffs and the arm cuffs. I prefer the arm cuffs. They tend to be a little bit more accurate than the wrist cuffs. So going along with blood pressure, take your medications as prescribed, whether that's to help with your blood pressure or heart rate, maybe diabetes. All of that's really important. And then stay hydrated before and after exercise. So make sure you're drinking enough water. They used to say, 8 cups of water a day was sufficient. And now they say that men should have approximately 13 cups of water from beverages, and women should have approximately 9 cups of water from beverages. And this doesn't have to be strictly water. Coffee counts, hot tea counts, things like that. It does depend on your age, your weight, activity level, kidney function. So all of those are very important. So why is exercise important? So 30 minutes of moderate activity a day, 5 days a week can decrease your risk of having a stroke by 25%. This is incredibly important because after one stroke, you have an increased risk for another stroke. So anything we can do to decrease the risk of stroke is going to be very beneficial. So what are the benefits of exercise? So it improves your thinking skills. Strokes can affect cognitive function. So when we exercise, we've got increased blood flow to the brain. So that helps to improve thinking skills. All these are very, very important. I know that when I'm sleeping better, I feel better, and all of this can be related to exercise. So some of the kind of the physiological benefits of exercise following stroke. So it lowers your blood pressure. As we talked about earlier, that's really important when decreasing your risk for a future stroke. It can lower cholesterol, and it lowers blood sugar. So this is really important for individuals with diabetes that are trying to maintain a healthy blood sugar. So let's talk about some exercise guidelines. So the American Heart Association and the American Stroke Association teamed up to put out guidelines on the amount of time that you should exercise during the week. So they recommend that adults exercise, do 150 minutes of moderate intensity activity or 75 minutes of vigorous intensity activity per week, spread out between 3 to 5 days. I know this sounds like a lot. It definitely sounds like a lot of activity. But 150 minutes spread out over 5 days is really just 30 minutes a day. So they also recommend moderate to high intensity muscle strengthening should occur twice a week. And then flexibility exercises should occur 2 to 3 days a week. And so we're going to kind of dive into these a little bit. So what is moderate intensity exercise? So again, that's 150 minutes broken up over 3 to 5 days. So they say you're working hard enough to break a sweat and raise your heart rate. So the CDC says that you can talk, but you can't sing your favorite song. So this is about 50 to 70% of your heart rate max. But I kind of like the talk but can't sing rule. That makes it kind of easy for you to remember. So some examples of moderate intensity exercise: brisk walking, water aerobics, dancing, gardening, tennis, bicycling, arm biking, pushing a wheelchair, and at-home exercise videos. So modifications can be made to all of these exercises too. So a lot of recumbent bikes or steppers allow wheelchair users to kind of roll their wheelchair up to it, so that way they don't have to transfer into the chair. You can kind of see in the picture, there's the raised garden beds. That's great if you're not able to get down to the floor, to the ground to do some gardening. You can use floats to assist in the pool. There's also pools. I know like our Bonnier location has parallel bars in the pool to help with balance. And it's got a ramp to enter. Some pools kind of have the lifts to help you get into. So all of those can be some great modifications to help be more independent and to achieve that moderate intensity exercise. Virtual classes and workout videos are so abundant right now. You can find them in all different levels. You can use weights that you have at the house. I know kind of weights are difficult to purchase these days, but you can use soup cans, water jugs, laundry detergent. All of those can help you with getting different weights, some good makeshift weights. I know I've done a lot of virtual videos over the past year. So vigorous intensity exercise. So that's 75 minutes per week broken up over 3 to 5 days. That comes out to be about an hour and 15 minutes throughout the week. So EDC says that you're breathing hard and fast. So you won't be able to say more than a few words without pausing for a breath. So remember, you can do vigorous or moderate activity. So this comes out to be about 70 to 85 of the heart rate max. But again, I think a nice, easy, fast rule is you can't say more than a few words. So just some examples of some vigorous intensity exercise would be walking uphill, swimming laps, aerobic dancing, heavy yard work, bicycling, arm biking, wheelchair sports. We have our excellent group Sportable in this community. And then also at-home exercise videos. Like I said, those can kind of come in any shape or form. So what happens if you do more? So if you're doing more than 150 minutes of your moderate activity or 75 minutes of your vigorous activity, you'll see even more health benefits. So muscle strengthening exercises. So they had recommended muscle strengthening workouts 2 to 3 times per week. It should target all major muscle groups. So you can do those a few different ways. So there's the workout machines at the gym. A lot of times they've got instructions on them. Gym personnel or trainers can help assist you with them. Depending on the gym, some of the machines you can roll up in a wheelchair as well, which is very helpful. Lifting free weights. This is nice for individuals with a stroke because you can use 2 different weights. If, for example, you need maybe a 5-pound on one arm and a 2-pound on the other arm, you can do that. Or Maybe you're only able to do it with one upper extremity, and that's fine too. Body weight exercises, sit to stands, push-ups, squats, heel raises, all of this uses your own body weight to help with your strengthening. So modifications can be made to these exercises as well. So maybe regular push-ups are not available to you. You could do the wall push-ups. You could either do those with one arm. Some people may be able to get kind of both arms up there and do it that way. Resistance bands. I like resistance bands because you can attach them, to the wall, or you can attach them to doorknobs. If you're only able to use one upper extremity, you could use two different bands if you needed to for different resistance, if you have one side that's stronger than the other. Flexibility exercises. These are really important after a stroke. You can do chair yoga or chair yoga. I have done a lot of home yoga videos over the past year, and there are some really great videos out there online. YouTube's got some great resources for yoga and also some of the adaptive chair yoga videos. Tai Chi is another great way to get your flexibility exercises in. It also helps with balance. And then there are just kind of your typical stretching exercises if yoga is not your jam. But stretching is really important after a stroke, maintaining your muscle length, especially if you have a lot of muscle tone, which can be pretty common. So that muscle length is important for walking. It's important for positioning your upper extremity or lower extremity on the wheelchair, like a brace or AFO. So this might be the most important slide, ways to stick with it. This is always a struggle. So keeping yourself accountable, having an exercise buddy, whether that's a significant other, whether that's a friend, having an exercise buddy is really important. A year ago when COVID started, my gym had shut down and I was not exercising as much as I should. So my roommate and I decided that we needed to exercise more. And so we started doing weightlifting Tuesday. So we didn't really like the name weightlifting Tuesday. So we switched it to tank top Tuesday because that sounded like a lot more fun than weightlifting Tuesday. And you know what? We've stuck with it for a year. So every Tuesday we have tank top Tuesday. And we get together and we lift weights and exercise, and it's been pretty good to stick with it for a year now. So appointments with a trainer or group class, even if they're virtual, can really help you stick with things. Scheduling your exercise is also important, even if you're doing it at home. If you're putting it on your schedule, you're more likely to do it. Setting realistic goals for yourself. So maybe your goal is to keep up with grandkids or to be able to get on the floor to play with grandkids. Maybe your goal is to walk faster. Maybe it's to improve your endurance so you don't have to nap during the day due to fatigue. Set something that's realistic. Running a marathon next month is not a realistic goal, and you're not going to achieve that. I'm not going to achieve that. So think about what's important to you and think about what you can realistically achieve. Find something that you enjoy. I hate the elliptical machine. I used to go to the gym. I would get on the elliptical machine, and I would be on there for 20 minutes going back and forth on my elliptical. And one day I was like, why am I doing this? I like to run. I like to hike. I like to bike. So now I skip the elliptical and do the exercises that I enjoy and get the same benefits, if not more, because I'm more engaged. I'm going longer because I enjoy it. So invest in a fitness watch to help with your goal setting. They can come in all different price ranges. Some of them, I found some at Walmart or on Amazon for less than $20 to track your steps and activity. You don't have to invest a lot of money to have something that can help you with your goal setting. And eating a healthy diet will also help you feel better and exercise better. It also help kind of promoting muscle strength. So some tips for working out at home. Have a designated space. Um, Something you don't have to kind of take up and down every single time. And something that you also kind of look at, pass by. I've got a spin bike in my basement. So every time I go down and do laundry, I look at my spin bike and it reminds me that, um, I need to plan that workout. Thought about putting it in my spare guest room, and I realized that I would close the door and I would never look at it and I wouldn't exercise on it. So it has really worked out well. Invest in a floor mat. This is great if you're getting onto the floor, and even if you're not, it's going to be a little bit easier on your joints. They come in all different thicknesses. I've got one right next to my bike in my basement. So I'm not standing on the concrete floors when I'm doing exercises. Stick with a program. Again, that'll help with kind of your accountability, and if you can have an accountability buddy with a program. Wear supportive shoes. It's easy if you're working out at home to kind of just wear your house slippers or some non-slip socks, but making sure you take the time to put on some supportive shoes. I think for the first little bit, I would try to work out barefoot, and then about 5 minutes into my workout, I realized I needed tennis shoes. So I pause my workout and then go grab them. So it's easier just to start off from the beginning. So find videos or apps that interest you, and try some new things. Over the past year, I've done a bunch of different workouts that I hadn't done before. And that's what's great about some of the YouTube videos is you don't have to commit to going to a class or paying for a class. Um, I did a few bar workouts and some Pilates videos, some new cardio and yoga videos, and it was really nice to try some new things. And I found some things I liked, found some things I didn't like, but that's definitely part of the process. Spend less time sitting if possible. So this is really important when you're getting back to improving your fitness. So if you're ambulatory, stand or walk during commercial breaks. Take regular breaks from looking at screens. Use that fitness watch that we talked about to remind you to get your steps in. A Fitbit that I've had for about a year and a half now, and it reminds me at the end of the hour if I haven't taken enough steps. It'll buzz at me, telling me I need to get up and move. Set a time limit on sedentary activities. So if you're sitting watching TV, your time limit, maybe you're going to watch one episode of whatever you're watching. I know this gets challenging with Netflix. Before I can grab the remote, it's already starting the next episode. But making sure you're telling yourself, okay, just one, and then you're getting up to doing different activities. Also, if you're using a wheelchair, think about pushing your own chair as much as possible. This is going to promote, number one, independence, but also it's going to help you get in that activity for the day. So, and with that, happy St. Patty's Day. Does anyone have any questions that I can answer?
I was happy to know I'm not expected to run a half a marathon next week.
Yeah, it's good. I am not either.
I was like, whoo.
People come with some, very lofty goals, and, lofty goals are excellent, but setting sort of shorter, more realistic goals that you can achieve in, a couple of weeks or a month are really important.
I'm wondering if anybody on the line has a suggestion of something they have tried to increase their fitness or their movement since they've been home. Anybody have any suggestions for the rest of the group?
I had a quick question.
Yes.
Just in terms of the online videos or apps to be used for exercises,
Yeah.
do you all have any ideas or suggestions for certain apps or videos, exercise videos to look into?
I was looking earlier and I just searched stroke exercises on YouTube and I found a number of videos. Also, just kind of searching chair yoga, I found some great resources.
Okay, awesome. Thank you so much.
Yeah.
I would also recommend the Peloton app. You don't have to have the actual Peloton bike. You can download the app and they have all types of weight bearing exercise videos, actual weighted exercises, yoga, meditation, strength training, cardio, HIIT, high intensity interval training. And you do not have to have the actual physical bike to take advantage of Peloton's actual videos. And they have really inspiring instructors.
They do. They also have like outdoor walking, like audio, which is great if you're, trying to get in increase the intensity of, a walk that you're taking. They do kind of like interval walks as well. So it's a great suggestion.
One other thought I had, I am in a wheelchair now, but I try not to sit in my chair. And I sit in all kinds of other chairs around my house, but I try to save the wheelchair for when I'm actually leaving the house to go somewhere or a meal time. And then with prepping and getting a meal ready, it's best if I can wheel between the fridge and the counter. But otherwise, my wheelchair sits in a corner and I mainly sit in kitchen, dining room, family room chairs throughout the day.
Yeah, that's great to, practice your transfers throughout the day as well.
I would like to know what pushing your own wheelchair looks like. If you need to be in a wheelchair, how do you push your own?
So I meant propelling, yeah, like self-propelling your chair.
Oh, okay.
Yeah.
Great. Any other questions or feedback? I think it would be kind of fun sometime in the future to maybe do some online apps and kind of go through what those look like as one of our classes so people can see what's out there and experience it a little bit. So I'll make a note of that and see if that might be something that would be helpful for folks.
I think that's a great suggestion.
Yeah, thank you, Logan. I appreciate it.
Thank you.
Yeah. Now I'd like to turn it over to Abby Colley. As I was saying earlier, Abby is an exercise physiologist and the PowerX lead at Sheltering Arms. And so we're happy to hear her perspective, to share some resources that we have locally, and then talk a little bit about, if you're not from the Richmond area, what are some things you need to look at if you want to get back to a gym. So thank you.
Hi, everybody. Thank you, Allison. Another suggestion of another location that everybody can go to for some exercise suggestions or a little bit guided exercise, the Sheltering Arms Rehabilitation Facebook page, as well as the Sheltering Arms Fitness and Wellness Facebook page, has a lot of our exercise physiologists demonstrating adaptive or modified exercises, going through chair cardio classes, on the Facebook page. So if you want another resource, check out our Facebook pages as well. I am going to share my screen. And I hope that I am doing this correctly because I've never done it before. All right.
Yes, we can see it.
Oh, good. Yay. All right. So as Allison said, I am one of our exercise physiologists at Sheltering Arms, and I am our PowerX program lead. So I'm going to talk first a little bit about the services that we offer at our Sheltering Arms outpatient locations. And then I'll talk about kind of what to look for if you're not local or Sheltering Arms is not accessible to you or you're out of the area, some options for you to look at in the community. So we offer several different fitness and wellness services at some of our Sheltering Arms outpatient locations. One of those being pool and fitness memberships. So similar to a gym membership, those are offered at our Reynolds and our Bon Air locations. We are not currently open to our membership services at the moment because of COVID. But keep an eye out on Facebook and for options on information on when those might reopen and in what capacity. So services we are offering right now are adaptive exercise training, which are one-on-one sessions with our exercise physiologists, as well as our specialty programs. So as I talked about a little bit, our pool and our fitness membership options, not available right now, but once they are, you get an orientation, and we also have partnerships with Silver Sneakers, Silver and Fit, and Renew Active, seeing if you can get some insurance-based memberships as well, so it's less out of pocket for you. So what we are offering are adaptive exercise training sessions. These can be land or pool-based. Our pool-based one-on-one sessions, they're only available at our Bon Air location, but they are one-on-one sessions, either 60 or 30 minutes, led by one of our exercise physiologists. And we program diagnosis specific, but also look at you as a whole. And look at promoting your overall health and wellness. And we also have virtual options as well. All right, my program, Power X. So this is one of our specialty programs offered at our Bon Air and our Reynolds location. Power X is a physician-referred, we call it a semi-supervised or transition to independent exercise program, utilizing one-on-one sessions within one of our exercise physiologists, as well as an independent workout session component. And our goal is to allow these participants to feel comfortable and confident exercising on their own. So we focus a lot on what you can do and showing you modifications on how to do things in a gym or a pool setting on your own based on your ability level. So it's a 3-month program. And for more information about that program, you can visit our website, going to our services offered, fitness and wellness, then our specialty programs for PowerX. So a little bit more, so anybody can participate in the PowerX program. We do have an independent component, so a certain level of processing cognitively is a requirement. And then specifically PowerX for your stroke recovery. So a lot of our stroke participants are people who were active before they had their stroke, and now they're not sure what to do. You know, they've gone through SAI, they've gone through outpatient physical therapy. Now what? What do I do now? How do I continue my progress after therapy? How do I continue to get better? And if I do go join a gym, what do I do? What can I do? What's safe for me? So this kind of transition to independent program, combining the independent component with our one-on-one sessions with our exercise physiologist, allows us to adapt exercises so that you're confident in doing them on your own. We show you what's safe, and then how best to do them, little tips and tricks on how to adjust things if you only have use of one upper extremity, things like that. So we place an emphasis on what you can do at home or in a gym environment to give you that confidence in exercising on your own. That's our goal of the 12-week program. Again, more information on that, you can email me. I'm going to put my contact information at the end or visit our website. Another one of our specialty programs is NeuroFit. This is at our Hanover location, and this is a exercise program specific for individuals who have neurologic impairments. So our goal of this program is to kind of bridge the gap between outpatient physical therapy and those who are not quite ready to exercise on their own. So PowerX is more for people, I'm ready to do it on my own. I just don't know where to start. NeuroFit is more, I'm just not ready yet. I would like a little bit more help. So our goals of this program are improving muscular strength, range of motion, central nervous system stimulation, balance, and functional movement. So a lot of the same goals that you have throughout physical therapy, but continued. It's not an insurance-based program. None of our specialty programs or our services are right now. But one of the biggest components of our NeuroFit program are utilizing the advanced technology. NeuroFit has a ton of cool toys to be able to help individuals with the different impairments move better. So we've got some different harnesses and body weight support devices, along with many, many other pieces of technology that are available to our NeuroFit participants. That if you've gone through physical therapy at Hanover, you might be familiar with and have used in therapy as well. Individuals who our NeuroFit program are designed for: brain injury, spinal cord injury, stroke survivors, and any neurological disorder. And then these are some of our requirements for participation. Again, more information can be found at our website, which was linked in the last slide. Again, go into our specialty programs where you'll find PowerX as well. All right. So for those who are not able to come to our Sheltering Arms location and utilize our services, I have a lot of information on what you can look for outside in the community. So the first thing that I'm going to talk about is what to look for in an exercise provider. And what I mean by that is somebody that you're going to do one-on-one sessions with. So whether that be personal training, our adaptive exercise training that we have at Sheltering Arms, what to look for that one-on-one assistance and program development for people who have had a stroke. So this list is by no means all inclusive. These are just the ones that I am most familiar with. So you want to look for credentials and certifications that show that this person has experience or is certified to develop exercise programs for somebody who has had a stroke. So the American College of Sports Medicine offers an exercise physiologist, a clinical exercise physiologist certification, or a certified inclusive fitness trainer. All of those individuals are going to be educated and certified to develop safe and effective exercise programs for the improvement of health, fitness, and overall physical condition for stroke survivors, as well as those with any chronic disease and healthy adults and individuals as well. The ACE certification is a medical exercise specialist. Again, they're certified and trained in establishing those same kind of exercise programs, as well as the NASM corrective exercise specialist. So all of those are ones who are going to be able to look at you as a whole and develop an exercise program that's going to benefit your fitness, but also taking into consideration what diagnosis you have. So things to look for outside of those certifications in an exercise provider or a facility. So you want to look for somebody who has experience and familiarity with the neuro rehab process, somebody who's going to be able to know what to do with that muscle tone that Logan talked about a little bit earlier, and how to program specifically for that, and as well as just your condition as a whole. So things to look for in a program or a facility or a certification that somebody offers is functional strengthening. So functional strengthening is when an exercise professional will watch you move and based on your movement patterns, figure out what areas of your body need to be strengthened or stretched, gaining more strength or flexibility in order to improve function and movement patterns. So basically it's strengthening to make your activities of daily living easier. Some kind of key words to look for in programs and facilities or a staff member's role are adaptive, inclusive, or post-rehabilitative. Those types of language in facilities advertising just show that careful thought has been put into accommodating people with a wide variety of ability levels and mobility. So Logan talked a little bit about recumbent equipment in gyms in her presentation. So that's going to be something that you'll want to look for in the facility that you're going to. So recumbent just means that it's got more of a chair-like seat. A typical bike seat is kind of that small triangle shaped with your pedals right under your hips. Recumbent has more of a chair-like seat. The seats are usually bigger. They've got a high back on them. And the pedals are usually out in front of you a little bit. So what that does is it allows the equipment to be a little bit more friendly for those who have had a stroke. And then some have removable seats as well to make them wheelchair accessible without having to do a transfer. A lot of these types of equipment also have larger pedals or a heel strap or heel support, which makes it a little bit easier to keep your foot onto the pedal versus the traditional single strap over the center of your foot. I know that ACAC, the YMCA, and American Family Fitness all have these types of equipment, and also some wheelchair accessible strength equipment as well. I'm not promoting them by any means. I don't know much about what they have as far as a stroke survivor population. I just know from a couple people who have been to those locations that they have some recumbent and wheelchair accessible equipment there. Most importantly, you want to look for an exercise provider who is creative, who is flexible in their programming, can think on their feet and be adaptive with their program, and trying different things to see what fits you best. And then ease of location. In order for you to stick to an exercise program or continue to go to a gym, we have to take away as many barriers as we can that limits you getting there or getting into the building. So you want to think about when you're shopping for a gym, the layout of the parking lot. Is it easy to get in and out of the building? Is the door automatic? Can you just wheel or walk up to the door and it opens? Do you have to pull with a handle? What side is that handle on? And then is the facility all on one floor? If it's not, how easy is it to get to the elevator? Where is that elevator going to take you once you get to the floor? The next floor, do you have to go all the way across once you've taken the elevator? And then how centrally located is the equipment? How easy is it for you to get from point A to point B once you're in the building to get to the things that you want to use? So it's all about limiting our barriers, making it as easy as possible for you to use the equipment and get in the building. So some questions to ask, and when you are shopping for different facilities to join, is you want to look at the staffing of their wellness floor, where all their exercise equipment is. So is it staffed during all hours of the day? So is there somebody there who can assist you in placing your affected foot onto a pedal, or adjusting a workout setting if the adjustment is on your affected upper extremity side? Is there somebody there who can wrap your hand in a couple different in active hands or a Nylatex wrap for you to be able to use both of your arms? So you want to ask those type of questions to see who is there at what times, to make sure that if you do need a little bit of assistance, that somebody's there to help you. And then if you are doing one-on-one personal training or something like that, do those exercise professionals obtain a medical clearance before beginning those sessions. That's pretty much an industry standard. So if you have any kind of qualifying factors, then they definitely should be doing that. But you just want to make sure that they're doing an appropriate screening before you begin working with them, and that they're obtaining that medical clearance from your physician if you've got certain conditions. And that gives your physician an opportunity to let that exercise professional know, here are some things that I don't really want them to do, or that you should avoid, or maybe a range that they want you to stay out of as far as your heart rate or intensity of the exercise that you're doing, just to prevent too high blood pressure spikes or things like that. As well as setting any weight limitations. Remember, you're your best advocate. So if you want to talk to your physician and your therapy team ahead of time, so that you know what you should and shouldn't be doing, or what you should be avoiding before going out to some of these community locations. So take a tour. That's going to be the most important thing for getting a feel of the environment of a place that you're going to join. Get a layout, as well as the physical and the emotional environment of a location. Are they welcoming? Are they very helpful? You know, do you feel supported when you're in there, as well as looking at the physical location? As far as, do they have a lot of things on the floor? Is the equipment spaced really close together? Would it be challenging for me to get in between these two pieces of equipment that I would want to join? You know, you want to kind of look at potential tripping hazards or things that could get in your way. Most places offer an orientation when you join, where some of their staff will take you around and kind of show you the equipment, how to adjust it, things like that. And so you want to make sure that you get one of those, so that you feel confident going in and adjusting this piece of equipment once you're on it, or before you get on it. And that's true for anywhere, for anybody that you would want to do, so that you don't walk into their wellness floor and go, oh, what do I do now? How do I adjust this? You want to make sure that you get that orientation, so that you're confident the first time you go in there. Some other questions to ask: what are their busier times during the day? Would it be feasible for your schedule to kind of plan around when there are fewer people in the building? When there are fewer people, it's a little bit easier to get around in those buildings. And then accessibility of the locker rooms. Are there benches, and are there bars in the showers? Look at the bar placements in relation to how you would need to transfer in and out of that shower. Is it on the side that most benefits you, versus being on your affected side if you're not able to use that upper extremity? All right. So I talked a little bit about the active hands and the Nylatex wrap. So this is a Nylatex wrap, and I love them for my stroke survivors. It's a little bit of a stretchy wrap, and it's got Velcro on one end, and the whole thing the Velcro can attach to. So I like to use these a lot to help wrap affected feet or hands onto equipment where maybe grip strength or foot placement, keeping a foot in a pedal, is a little bit more challenging, just to help prevent the foot slipping out of a pedal, or on an arm bike, the hand to slip off. So I love these, and you can wrap them around after you've gripped. You can wrap them around the handle in which you're trying to grip, or once your foot is in a pedal, wrap it around the foot pedal. So I love that. And then an active hand. So this one is just for your hand, and it wraps around your wrist, and you put your hand in here, you wrap around whatever handle you're trying to grip, whether that be a dumbbell, whether that be a strength training handle, whether that be an arm bike handle. And then after you're gripping it, we wrap this around and thread it back through the wrist strap. And it just helps, again, like the Nylatex wrap, to hold that hand on there. The Nylatex wrap just has a couple more applications versus the active hands. So those are really great tools to have with you when you're going shopping for an outside gym, and you want to be able to use that upper extremity if your grip strength is not as strong, or to be able to hold a foot onto something. And I linked both of those in this slide. And the Active Hands, the top one is the Active Hands brand. They are a little pricey. So I also found one that's very similar, but at a much more cost-effective price on that second one. And that's it. Any questions for me?
I had a quick question.
Yes.
Just about the NeuroFit program. Say if you were to just be starting outpatient or be an outpatient for about a month or two, would you be able to start the NeuroFit program while also doing outpatient, or is it just for post-outpatient people?
That's a great question. So the question was, is NeuroFit one of our specialty programs that's able to be completed alongside outpatient physical therapy, or you have to start NeuroFit after physical therapy? And you can do both at the same time, as well as with our PowerX program.
Okay, great. Thank you so much.
Oh, you're welcome.
I'd love to put in a plug for NeuroFit. Abby has seen me there. Those 2 sessions are the highlights of my week. I adore it. It's so empowering, and really, I'm still in outpatient treatment, so I'm doing it at the same time. And I have like the whole team comes together to cheer me on. I adore my time at NeuroFit.
Oh, thank you. I'm so glad to hear you say that.
I would like to transition to the pool, but I don't want to say goodbye to the Hanover Clinic completely. So there's somebody trying to navigate that for me.
Yep, we'll get on it. You can do both.
I think we've had a great overview about why we need to exercise, the importance of that, and how we go about doing it, whether you're enrolled in a program, locally, or what to look at for agencies outside, as well as just some things you might be able to do in your home. So as they both said, exercise is critical in your recovery. It keeps you moving, it keeps you strong, prevents a lot of health issues that might come up. So a really important thing, and I really appreciate everyone's time today and your knowledge. Our next community transition event will be in June, and don't know what the topic is yet, but we will let you all know, and hopefully you'll be able to join us for some future events, as we need to continue to educate ourselves as you guys all continue to heal and recover. So thank you all so much for your time today.